A little bit about the background of honey is that it was approved by the U.S. A systematic review of the literature entitled Honey as a Topical
Our third article is titled, Is Manuka Honey a Credible Alternative to Silver in Wound Care? This article reviewed 72 articles to compare antimicrobial effects of honey with silver for the prevention and management of wound infections and discusses the possible reasons for skepticism for clinical use of honey. When comparing Manuka honey to silver, in vitro studies found both to have similar antimicrobial effects. It highlighted that no honey-resistant bacteria had been identified in wounds, but there are several known silver-resistant bacterial strains. Also, it found that silver is cytotoxic to fibroblasts and keratinocytes, which we know are important for wound healing, and that honey is more cost-efficient. Possible reasons for skepticism with Manuka honey are that much of the clinical evidence before 2000 was based upon the use of honey that was poorly characterized. Until 1970s, honey that was employed in hospitals was non-sterile and intended for nutrition, leading doctors to doubt its clinical use. And there's a lack of systematic reviews of the literature and randomized control trials available. Most of the literature consists of small groups, poorly defined wound etiologies, and did not discuss the type of or concentration of honey used. In regards to our PICO question, the research does not support that Manuka honey has improved antimicrobial effects over nanocrystalline. It only appears to have similar effects. Honey lacks the support of large, randomized controlled trials needed to make strong recommendations for its clinical use over nanocrystalline. However, despite this lack of strong evidence to support its use as a primary antimicrobial intervention, some patients will benefit more from the use of Manuka honey than that from nanocrystalline. For example, known silver sensitivities require patients that require frequent ultrasounds or MRIs are infected by silver-resistant strains. We as healthcare providers must use our clinical reasoning skills to select the most appropriate antimicrobial agent based on the goals and needs of our patients. It is important to remember that physical therapy is an evidence-based practice, so implementation of interventions that lack strong support from the literature must be coupled with sound clinical decision-making in order to provide optimal care.
A 65-year-old man presents to PT reporting wound on bottom of right foot for 6 weeks. His past medical history is diabetes type 2 for the past 10 years, hypertension, and hypercholesterolemia. He's currently taking atenolol and metformin. His lab values are his glucose is 145, Hemoglobin A1C is 6.5%, and his biopsy results from his wound were positive for Staphylococcus aureus, indicating critical colonization. His wound evaluation, his capillary refill was less than 10 seconds, indicating within normal limits. His ABI was 1.2, which can possibly signify calcified vessels secondary to his diabetes. His pulses in his tibialis, posterior tib, and dorsalis pedis were 2+ bilaterally. There's unremarkable edema. Wound measurements and location was the right plantar surface of second metatarsal head of forefoot, a biofilm present indicating infection. His wound measurements were 2.5 times 3 times 0.5 centimeters, and he had moderate slough on his wound surface, as well as a moderate purulent exudate with increased odor.
The patient's primary health condition is a diabetic foot wound on his right plantar surface of his second metatarsal head with secondary health conditions of diabetes, hypertension, and hypercholesterolemia. His body structure and function impairments are decreased protective sensation over the plantar surfaces of his feet bilaterally, decreased ankle strength in plantar flexion and dorsiflexion on the right, decreased ankle active range of motion in dorsiflexion bilaterally, and he had impaired standing balance. His activity limitations are ambulation, ascending and descending the stairs in his home, and standing for periods longer than 20 minutes. In terms of his participation restrictions, he's unable to walk distances further than 300 feet, which impedes his ability to walk his dog around his neighborhood. He requires an increased amount of time and assistance from his wife in order to reach his second-floor bedroom, and he's unable to stand at the easel during his painting classes. His personal factors are that he enjoys being active, he has a short attention span, and he can be inconsistent with his medical compliance. His environmental factors are the supportive wife, his bedroom is on the second floor of his house, and his painting classes provide social interaction for him.
So the PT implications regarding debridement and dressing for this patient. So for debridement, we chose to use high-frequency ultrasonic debridement. We chose to use this due to its rapid and selective debridement purposes, and it is also safe to use with infections. The dressings we chose were a honey contact layer used for a primary dressing, as well as a foam dressing with an offloading device for this man's pressure relief. PT implications for infection control. Honey and silver both can be used for antimicrobial purposes when treating a chronic infected wound. Based on our patient and what we found in the literature, we chose to use honey. We chose to use honey based on the following factors: non-cytotoxic to fibroblasts and keratinocytes, no risk of bacterial resistance, low pH, therefore helping to convert a chronic wound into a more acute phase, and it is more cost efficient. PT implications regarding exercise. So once our patient's infection is under control, we would like to encourage and focus on ankle strengthening, stretching in order to increase ankle range of motion, and improving cardiovascular health. We would do this after the wound is in a more mature stage. We also want to work on balance training, gait training, and the selection of a proper offloading device, and of course patient education regarding proper footwear, regularly inspecting feet, proper skin and nail management.
So to bring things all together, from our literature search, we found that honey dressing has been proven to be equally as effective as silver dressings in terms of antimicrobial properties based on the following criteria: enzyme stimulation, restoration of pH balance, odor control, and control of bioburden and decreasing the spread of infection. Generally, using honey as an antimicrobial for wounds is indicated due to its cost effectiveness. There's no known bacterial resistance to honey, and its effectiveness of jumpstarting chronic wounds in the healing process.